When we talk about the mental health crisis, the first truth we have to acknowledge is that it is much bigger than most people realize. It is not something that only affects a small group of individuals in isolated circumstances. This is not a rare diagnosis that lives only in medical textbooks. Mental health struggles, whether they come in the form of anxiety, depression, panic, burnout, or trauma, are everywhere. In fact, they are so common that in many circles they have almost become invisible, hidden in plain sight. It is what I call the hidden epidemic. Unlike heart disease, diabetes, or cancer, it doesn't always announce itself with a lab result, a blood pressure reading, or a tumor on a scan. It hides behind smiles, behind business, behind the phrase, "I'm fine." And that invisibility is what makes it so dangerous. You see, when we ignore something that is quietly spreading, it gains power. It creeps deeper into families, workplaces, and communities until one day we realize the damage is already done. Think about how we treat physical illness. If someone has a broken bone, they are rushed to the hospital. If someone has a fever, we check their vitals, we seek treatment. But if someone has a broken spirit, their joy has been quietly drained out of them. If their mind feels heavy every morning, when they wake up, too often we look away. We dismiss it as weakness, or worse, we tell them to toughen up. This is the stigma that keeps the hidden epidemic alive. But let me ask you this. Why do we separate the brain from the body? The mind is an organ just like the heart, the lungs, the kidneys. If your heart misfires, you go to a cardiologist. If your lungs collapse, you seek urgent care. So why is it that when the brain's chemistry is disrupted, when stress hormones overwhelm its natural balance, we are told to simply push through it? We would never say that to someone with pneumonia or a fractured rib. Yet we say it to those living with anxiety or depression every single day. This is not just a medical misunderstanding, it is a philosophical mistake. We have falsely divided human suffering into real and imagined into physical and mental, when in truth, they are all deeply interconnected. The hidden epidemic thrives because it hides behind masks. A mother can drive her kids to school, pack their lunches, and smile at the teacher, yet feel like she is drowning inside. A young professional can hit every deadline, attend every meeting, and still cry themselves to sleep at night. A senior can sit at the family table, laughing at the right moments, while secretly feeling more isolated than ever before. We cannot rely on appearances to tell us the truth. We have to listen deeper. We have to start asking questions like, how are you really? And we have to be prepared to hear the uncomfortable answers. Now, here's the most striking part. The World Health Organization estimates that hundreds of millions of people worldwide are living with some form of mental illness, yet less than half will ever receive treatment. That means more than half are carrying their pain silently, pretending to function while fighting battles no one can see. And if untreated, these conditions don't just affect mood, they raise blood pressure, disrupt sleep, weaken the immune system, and shorten life expectancy. In other words, the hidden epidemic of mental health is not only emotional, it is physical. It literally robs years from people's lives. But let's look at this not just through a clinical lens, but through a human one. Every one of us has moments when we feel overwhelmed, when our thoughts feel heavier than our bodies can carry. The difference is whether we have the tools and the support to move through those moments, or whether we collapse beneath them. The mental health crisis is not about them out there. It is about all of us. If it doesn't touch you directly, it touches your spouse, your child, your parent, your neighbor, your friend. And this is where the philosophical depth comes in. We live in a society that celebrates physical resilience, run faster, lift heavier, work longer. But we rarely celebrate emotional resilience, the ability to sit with pain, to admit vulnerability, to ask for help. We treat physical scars as badges of courage, but treat emotional scars as something to hide. This is backwards. Because courage is not pretending you are fine. Courage is standing up in your truth and saying, I need support. That act of honesty is how healing begins, both for the individual and for the culture at large. So when we talk about the hidden epidemic, we're not just talking about diagnoses in medical journals. We're talking about the silent suffering that fills our homes, our schools, and our workplaces. We're talking about the invisible weight carried by people who look like they've got it all together. The lesson here is simple but profound. Just because you cannot see it does not mean it isn't real. And just because it is invisible does not mean it is untreatable. The challenge I want to leave with you is this. The next time you're tempted to assume someone is fine because they're functioning, pause, look deeper, ask questions. And if that someone is you, If you've been silently carrying a weight you've been too afraid to share, recognize that you're not broken, you are human. And like any human condition, healing is possible when we stop hiding and start addressing it with the same seriousness we give to every other epidemic. Because the hidden epidemic of mental health is only hidden until we choose to see it. And once we see it, we can no longer look away. If the hidden epidemic is about what remains unseen, then the next challenge we face is about what drives it beneath the surface, the stigma. Stigma is not a disease of the brain. It is a disease of perception. It is the silent force that tells people to keep their struggles to themselves, that whispers, if you admit this, you'll be judged, you'll be rejected, you'll be seen as weak. And when you think about it, stigma has probably done more damage than the illnesses themselves. Because while anxiety, depression, and trauma are conditions that can be treated, stigma is what prevents people from ever reaching for that treatment in the first place. Imagine a young man feeling crushing panic before work every morning. He doesn't sleep well, his chest tightens, his hands shake. But instead of telling his family or seeking professional help, he puts on a mask. Why? Because he doesn't want to be labeled as fragile or unstable, or consider an older woman who feels waves of hopelessness after losing her spouse. Rather than admitting to her children that she's overwhelmed, she hides it behind her smile, fearing that they'll see her as a burden. This is the reality for millions of people. They are not just fighting their illness, they are fighting the shame that society has built around it. Stigma doesn't just live in other people's words, it lives in our own self-talk. How often do we say things to ourselves we would never say to someone else? You should be stronger. Don't let people see your weakness. Other people have it worse. What's wrong with you? This inner critic is fueled by the stigma we've absorbed since childhood, from cultures that taught us to suppress emotions, to families that told us, just get over it, to workplaces that reward productivity but penalize vulnerability. The message is clear: keep quiet, stay composed, and don't let anyone know you're hurting. But here's the philosophical question: what is weakness? If someone breaks their leg and they ask for a crutch, do we see them as weak or as practical? If someone has diabetes and they take insulin, do we shame them for it? Or do we see them as managing their health wisely? Then why, when someone seeks therapy, medication, or simply asks for support, do we see it as weakness? The answer is cultural, not logical. We have created an artificial hierarchy that says physical illness deserves compassion, but mental illness deserves suspicion. That is not science, that is stigma. And here's the paradox: the very act that stigma defines as weakness, asking for help, is, in truth, the essence of strength. It takes courage to admit you are struggling. It takes honesty to face the reality of your own mind. And it takes wisdom to reach out for healing instead of suffering in silence. Stigma blinds us to this truth, and in doing so, it traps millions of people in unnecessary suffering. Let's look deeper at how stigma shapes behavior. In many communities, people would rather hide their pain until it explodes in destructive ways, addiction, broken relationships, even suicide, than risk being judged. Families often minimize their loved ones' struggles, not because they don't care, but because they themselves are afraid of being seen as the family with problems. And institutions, whether schools or workplaces, often lack systems of support because acknowledging mental health openly feels too uncomfortable. It is a cycle of silence, and every silence fuels the crisis further. Now, breaking stigma doesn't require us to become therapists or experts. It requires us to become listeners, safe spaces, and truth tellers. When someone confides their pain, the most healing response is not a solution, it is presence. I hear you, I believe you, you're not alone. Those words dismantle shame. They tell the other person, you don't need to wear a mask here. And sometimes those simple acknowledgments can save a life. Think of what would happen if we shifted our cultural lens. Imagine if mental health care was as normalized as dental checkups. Imagine if schools taught children not just math and science, but also emotional resilience and healthy coping skills. Imagine if workplaces treated therapy appointments with the same respect as physical doctor visits. That would not only reduce suffering, it would transform the way we live together as human beings. Because when stigma dissolves, empathy rises. And when empathy rises, healing becomes possible on a collective scale. So the question I want to leave you with is this: what mask are you wearing and why? Is it keeping you safe, or is it keeping you silent? And whose mask are you refusing to see? Perhaps because stigma has trained your eyes to look away. Every time we choose compassion over judgment, every time we create space for someone to speak openly, we chip away at stigma's power. The stigma around mental health will not disappear overnight, but it will dissolve one conversation at a time, one act of courage at a time, one human connection at a time. And the truth is, the courage to be vulnerable is contagious. When one person steps forward without shame, others find the strength to do the same. That is how revolutions begin, not with a policy or a law, but with a shift in what we dare to say out loud. So I challenge you, do not let stigma define how you see yourself or how you treat others. Because stigma may silence voices, but compassion has the power to set them free. And once we choose compassion, we will never go back. If stigma is the wall that keeps people silent, then access is the locked door that prevents them from stepping forward, even when they find the courage to speak. We cannot talk about the mental health crisis without acknowledging the simple truth that for millions of people, help is either too far away, too expensive, or too complicated to reach. And when you step back and think about it, that is the tragedy of our times. We have the knowledge, we have the science, we even have the therapies that can change lives, but for many, they remain out of reach. Imagine a young single mother struggling with postpartum depression. She knows something isn't right. She cries constantly. She feels detached from her baby. She has intrusive thoughts she doesn't dare say out loud. But when she calls around for help, she's told the next available appointment is 6 months away. 6 months. For her, 6 months is an eternity. Or think of a teenager in a rural community experiencing severe anxiety. The closest mental health professional may be hours away, and his family may not even have the transportation or financial resources to make it possible. So he suffers silently, with his only companions being fear and confusion. These stories are not exceptions. They are the reality for far too many. What this tells us is that stigma and access are not separate problems. They feed each other. Stigma convinces people not to seek help. But even when someone finally decides to reach out, limited access can reinforce the belief that they were foolish to try. Over time, this cycle doesn't just discourage individuals, it weakens trust in the entire system. If you can't find support when you need it most, you begin to lose faith that support even exists. And that sense of abandonment can deepen the crisis. But let's go deeper. Access is not just about appointments and insurance coverage, it's about culture. It's about whether your community even recognizes the legitimacy of mental health. In some neighborhoods, therapy is seen as a luxury for the wealthy, not a necessity for survival. In others, the only mental health services available are medications prescribed in hurried visits, with no time for understanding the deeper causes. And in many parts of the world, access to care means navigating systems that are not designed for the patient at all. They're designed for bureaucracy. That alone is enough to drive someone back into silence. Now, you might be wondering, what can actually be done? This is where the philosophical depth of the conversation matters. Because at its core, access is not just a logistical problem, it is a moral one. If we as a society say that mental health matters, then we must make it as accessible as physical health. If we say that depression is as real as diabetes, then we must ensure treatment is as available as insulin. Otherwise, our values are hollow and our compassion is selective. There are solutions, but they require us to think differently. Telemedicine, for instance, has opened the door for millions who could not physically get to a clinic. Online support groups and digital therapy tools are breaking down barriers. Community-based programs where schools, churches, and workplaces create spaces for mental health conversations are shifting access from the clinic to everyday life. And most importantly, we must create systems where asking for help doesn't require navigating an obstacle course of paperwork, waitlists, and insurance approvals. Because every barrier added to the process increases the risk that someone will give up altogether. But access also requires us to expand our definition of what counts as care. Sometimes it's not a psychiatrist with decades of training that someone needs first. It's a safe listener, a mentor, a support group, or even a compassionate friend who can point them toward the next step. Access begins with connection. And connection begins with each of us recognizing that we can play a role in making support available, even if we're not licensed professionals. What's fascinating, though, is how this conversation connects to something deeper in human psychology. When we deny people access to help, we're not just withholding a service, we're denying their dignity. We're sending a message that their pain is not worthy of urgency, that their suffering is something they should learn to tolerate. That is not just a failure of healthcare, it is a failure of humanity. And when you look around at the rising rates of suicide, addiction, and burnout, you see the cost of that failure written into every statistic. But I want you to imagine the opposite for a moment. Imagine a world where mental health services were as easy to access as calling a friend, where every community had trained professionals available within days, not months, where technology and empathy combined to remove distance, stigma, and cost as barriers. What would happen then? We would see a society where people sought help early before crises escalated. We would see families preserved, lives saved, and communities strengthened. Because when access becomes universal, healing becomes possible. So here is the challenge. Access is not just a policy issue, it's a personal one. Ask yourself, what role can I play in making support available to someone else? Can I be the person who listens without judgment? Can I advocate for better mental health resources in my workplace or community? Can I support organizations that are building bridges where walls once stood? Access expands not just through governments and institutions, but through the daily choices of people who decide that no one should suffer alone. And that's the truth. I want you to hold on to every barrier to mental health care is a barrier we have built, which means it is a barrier we can take down. The doors are locked, but the keys are in our hands. It is not a question of possibility. It is a question of will, because access is not about convenience. It is about survival. And when we finally decide that mental health is not a privilege for the few, but a right for all, then and only then will we see the beginning of true healing. If stigma is the silence and access is the locked door, then treatment is the light we all long for. But too often, that light flickers unevenly, depending on where you live, what you earn, or even what label a system decides to put on your pain. The truth about our current approach to mental health treatment is sobering. It is inconsistent, fragmented, and in many ways outdated. Some people receive world-class therapy, evidence-based interventions, and compassionate care. Others, sometimes in the very same city, are handed nothing more than a prescription after a 10-minute consultation, or worse, are told to wait it out and hope things improve on their own. This uneven landscape creates a deeper wound than we realize, because mental health is not like a broken bone that will naturally mend while you wait. It is more like an untreated infection. The longer it lingers, the more it spreads, touching every corner of life, relationships, work, physical health, and even one's sense of meaning. When treatment is delayed or delivered in a shallow, disconnected way, we are not just missing an opportunity to heal, we are deepening the crisis itself. Think about it. If someone is struggling with severe depression, what message do they receive when they are put on a wait list for therapy that stretches 6 months? Or when the treatment they do get is rushed, mechanical, and impersonal? They hear, in subtle but powerful ways, that their pain is not urgent, that their suffering is not fully recognized, and in that gap between recognition and resolution, despair often grows. But let me take you a little deeper. Treatment is not only about access, it is about alignment. It's about aligning science with humanity, medicine with meaning. We have brilliant research showing the effectiveness of therapies like cognitive behavioral therapy, mindfulness-based interventions, and trauma-informed care. We have medications that, when properly managed, can be life-saving. Yet too often, treatments are handed out without personalization, without listening to the individual's story, without considering culture, background, or belief systems. When this happens, treatment becomes a transaction, not a transformation. And when people sense they are being processed instead of understood, they disengage. This is where we must remember that treatment is not just a clinical intervention. It is a human connection. Healing does not happen in sterile rooms or through checkboxes on a chart alone. Healing happens when someone feels seen, when their pain is acknowledged, and when their path forward is created with them, not for them. That is the kind of treatment that ignites hope. And hope, in many ways, is the most powerful medicine we have. Now, here's something many people overlook. Treatment is not only about reducing symptoms, it is about restoring dignity. Too often, we measure success in mental health treatment by whether someone can return to work, get out of bed, or reduce their hospital visits. Those are important metrics, of course. But the deeper question is, does the treatment help the person reconnect with their purpose, their identity, their will to live fully? If treatment reduces symptoms but leaves someone feeling hollow or disconnected, have we truly healed them, or have we only quieted the surface while the deeper currents remain unsettled? The philosophical dimension here is profound. To treat mental health properly, we must see the person not as a collection of symptoms, but as a whole being, a mind, a body, and a soul that longs for coherence. When we treat only the biology and ignore the psychology, when we treat only the psychology and ignore the spirituality, we deliver partial care. And partial care rarely leads to lasting transformation. But let's not forget the systemic challenges. Many mental health professionals themselves are overworked, under-resourced, and struggling with burnout. This means even the best-intentioned providers are often forced into a model of quick fixes rather than deep healing. And when providers are drained, patients feel it. So, if we want to improve treatment, we must also care for the caregivers because their well-being directly shapes the quality of healing they can offer. Solutions exist, but they require courage. Integrated care models that combine primary health, mental health, and community resources are already showing promise. Holistic approaches that blend therapy, lifestyle changes, medication when needed, and spiritual or community support are producing results far more sustainable than isolated interventions. And new frontiers, such as psychedelic-assisted therapy and advanced neurostimulation techniques, hold great promise if approached responsibly. But all of these require one essential ingredient: the belief that every person deserves the very best treatment possible, regardless of status, geography, or wealth. And here's the heart of it. Treatment is not just about professionals. It's about partnership. It's about recognizing that the person seeking help is not a passive recipient, but an active participant in their healing. The most effective treatments are collaborative, where the individual's voice guides the process. Because when people feel ownership over their healing, they are far more likely to stay the course and truly transform. So, where does this leave us? It leaves us with a call to reimagine treatment, not as a privilege, but as a standard, not as a fragmented patchwork, but as a coherent system rooted in compassion, science, and humanity. The mental health crisis will not be solved by simply adding more clinics or writing more prescriptions. It will be solved by aligning our treatments with the dignity of the human spirit, by personalizing care, by closing the gaps that leave people stranded in despair, and by remembering that the goal of treatment is not just survival, it is wholeness. And I'll leave you with this thought. True treatment is not about quieting the storm inside a person. It is about teaching them to dance with it, to find meaning within it, and to emerge stronger because of it. Healing is possible, but only if we are bold enough to make treatment as human as the suffering it seeks to heal.